Okay, so as Joanne said, my name is Kevin Lemley, and I specialize in kidney diseases, and that's called a nephrologist. Urologists are the surgeons that specialize in the kidney. Nephrologists are the medical doctors. I'm in particular a pediatric nephrologist, meaning that I specialize in kids' kidneys, but I've had quite a bit of experience with adults with NPS and other diseases. So the kidney is one of the vital organs that is often affected by Nephrotic Syndrome. Generally, we think of kidneys as working like filters to clean the blood. In essence, they remove waste from the blood and excrete those wastes in the urine to get them out of the body. They do that and actually do an awful lot more. So one thing they do is regulate how much salt is in the body. And by doing this, they can strongly influence blood pressure. So high blood pressure can be one of the hallmarks of many kidney diseases. And in kind of a vicious circle, high blood pressure also damages the kidneys. So when the kidneys don't work, they can even get worse from not working. Adele, of course, will know that the kidneys also affect bone health because they activate vitamin D, that our normal dietary D is not active and requires activation steps, of which the last one the kidney does. And they prevent anemia by making the hormone that Lance Armstrong didn't use that tells the bone marrow to make red blood cells. So a common manifestation, kind of an easy manifestation of kidney disease in general, is having protein in the urine. So the kidney filters act like little sieves, and when they're healthy, they let wastes leak out into the urine because these are generally very small molecules, but they hold back the proteins that are in the blood, which tend to be bigger. So a leaky filter allows some protein to appear in the urine. The filter can be leaky enough that red blood cells, which are very much bigger, also leak through the filter in some diseases. This is called hematuria. About 20 to 30% of nail patella patients will have mild to moderate proteinuria. So it is not a very uncommon finding. Proteinuria is what we call an excessive amount of protein in the urine. About 10 to 20% of nail patella patients will have blood in the urine that is abnormal, but not necessarily blood that you can see. So we call it microscopic hematuria. You can test for it or see it under a microscope. More severe proteinuria in nail patella syndrome is uncommon. It's probably less than 10% of patients, but generally has more serious implications for health. So this can be bad enough that you literally have what's called nephrotic syndrome, where you have a large amount of protein in the urine and fluid retention and swelling in the body and low amounts of protein in the blood. So the final way the kidney can show itself to be damaged is by being unable, not just leaking some things it shouldn't leak, but unable to eliminate waste from the body. Again, cleaning the blood, the kidney does, is generally getting waste out into the urine from the blood. The kidneys get rid of all sorts of wastes, but when doctors talk to each other about kidney function, they usually talk about the blood level of creatinine. That's something that's made constantly. It's excreted by the kidney, but if the kidneys don't work, it builds up in the blood. So a high blood creatinine level corresponds to low kidney function. High blood pressure is also a sign of kidney disease, but especially in older people, it's a common enough thing to find, even with normal kidney function, that it's not a terribly specific sign of kidney disease. It's just one that you will also see. So kidney disease in patients with nail patella syndrome can, with two siblings, say, be totally different. One person can have very, very mild findings with a little protein in the urine and normal kidney function, and another person can go into kidney failure. So it's not due to the gene mutation in nail patella syndrome per se. Our hypothesis is that there is another gene mutation that affects specifically the kidney, and if it's two siblings, one of them has nail patella mutation alone and the other has that and this other mutation and will have the more severe kidney disease. So Nail patella syndrome does not typically lead to severe kidney disease, but it can, and we saw in the chat that plenty of people, and we know about Maddie, has needed a kidney transplant. So that does happen, even though it is not common. Patients who have nail patella syndrome who develop kidney failure are, generally speaking, considered good candidates for kidney transplantation. There is no reason they should not be considered for it. One thing you need to know is if you get a kidney transplant and you had nail patella syndrome, it does not recur in the transplant kidney. So people who say have diabetes who get a transplant are at risk for diabetes recurring in the kidney, but nail patella syndrome, that does not happen. So you may ask, I feel fine, do I really need to be checked for kidney disease? And if so, how do I get checked? And basically, the first level of check is pretty simple to do, and yet is fairly sensitive, and that's a simple check of the urine. And you may have seen it in the test. You give a urine specimen, the nurse sticks a little stick into the cup, flicks it off, watches it, and looks what color develops. And the test strips are actually a fairly good qualitative check of whether you have blood or protein in the urine in excess. So if your urine test is positive, say for protein, then probably your doctor is going to want to repeat that at least once, because you can get protein in the urine that doesn't last, that is not from disease. But if it repeats, then they may want to do other testing, including blood tests in particular, to look at your kidney function. So nail patella syndrome is not the only disease that can cause hematuria and proteinuria, blood and protein in the urine. And therefore, one shouldn't just rush and say, okay, you've got nail patella syndrome, you have blood and urine, it's due to nail patella syndrome. You have to be careful to make sure you've excluded any other disease. In terms of when you should start doing that, small children are very rarely badly affected with nail patella syndrome. So I think the simple test on a urine specimen can wait until a child is old enough to easily give a urine specimen to be able to pee into the cup. So one situation that's a little bit different from this general lack of having a really high risk of having kidney failure is during pregnancy. And nail patella syndrome has a very increased risk of a disease called preeclampsia that can occur in up to a third of patients with nail patella syndrome during pregnancy versus about 4% of patients in the general population. So the risk is much higher, and that has to be taken into consideration. So if you're planning a pregnancy and you have nail patella syndrome, you need to make sure your obstetrician knows that you have it, and they may want to refer you to a high-risk obstetrician. So at a minimum, usually if you have a pregnancy with nail patella syndrome, your blood pressure and urine tests will be done more frequently than they would in patients who do not have nail patella syndrome. So what does it mean if you have involvement with your kidneys in nail patella syndrome? So again, remember, it's a fairly high percentage of patients that have blood or protein in the urine, but most people with nail patella syndrome will retain adequate kidney function throughout their lives, not to require dialysis and transplantation. So it is something that you have to keep track of, but is not something you're at terribly high risk for. So if your kidney function and your blood pressure is normal and you're an adult, you probably wouldn't even be sent by your internist to see a kidney specialist. They tend to have a very high threshold before they send on. You do need to keep an eye on your blood pressure. That's not too hard to do, but it's very important in your general health and in your kidney health. And some people who have large amounts of proteinuria, meaning abnormal, not meaning ultra large, that stays with them would likely benefit from being treated with a class of drugs that are basically anti-blood pressure drugs called ACE inhibitors. So example would be lisinopril or enalapril. That is generally thought to be good for kidney diseases that have protein in the urine. It protects the kidneys. At this point, we don't have any specific treatment for kidney involvement in nail patella syndrome or any treatment for nail patella syndrome in general. So it's important to note that just having nail patella syndrome doesn't mean you're not going to get a kidney disease having nothing to do with it. So there are many things you can do that Adele referred to in terms of your general health. The two most common causes of kidney failure in the United States in adults are diabetes and hypertension. So any patient with nail patella syndrome should follow a healthy lifestyle to try to avoid these diseases. So no smoking, low salt, heart healthy diet, exercise, avoid obesity. So later in the series, as with everybody else, I'll give a little more detailed talk that goes into more of what we started on today, and I look forward to speaking with you at that